today. For those of you who don't know me, my name is Luke Wortley. I'm the new director of the Upper Midwest Telehealth Resource Center, taking over from Dr. Anwar, who is transitioning into a role that she has actually already previously held here at the Indiana Rural Health Association, looking to expand our efforts in the substance use disorder prevention, treatment, and recovery space in the state of Indiana. Along those lines, we're also very happy to be joined by one of my other colleagues, Kathy Walker. She is the program director for the Healthy Minds, Healthy Lives program. Kathy joined the IRHA in 2019 after many years with the Community Action Program of Western Indiana. She's also worked in tobacco prevention and cessation, the Indiana Department of Health, school-based youth leadership and mentoring, as well as many other capacities in her distinguished career. Kathy, I'm going to go ahead and hand it off to you. Thank you for joining us today.
Great. Thank you very much for that very generous introduction. I'm going to go ahead and get started with our presentation about the mental health landscape in Indiana with a focus on rural and farming communities. Whoops, sorry, the button goes a little quicker than, okay, so the funding, our funding disclosure, our funding for the Healthy Minds, Healthy Lives program did come from the Indiana State Department of Agriculture and in turn to them from USDA and a branch of that. So just to let you know that. So what are we looking at? Stress and mental health in farming and rural and agricultural communities is an issue. There's a lot of stress. Farmers are really the backbone of America, and they contribute to our basic daily needs on many fronts. And they're grapple with a lot of uncertainty on a regular basis. And so then when we have situations like COVID that really kind of shook us all up some, the levels of uncertainty are exacerbated. So they struggled from disrupted supply chain and financial instability, even more so during COVID. So as a result, a lot of mental health professionals are concerned about the rate of undiagnosed mood disorders and mental health issues. By the way, farmers do have, in rural communities, do have some of the highest suicide rates in the country, even globally. So, and we'll get to talking about that some too. Suicide happens a lot more than we think it does. And so we need to start openly talking about mental health conditions that may lead to suicidal ideation, and we'll get into that. But so unique stressors from the farming community, as I mentioned already. In the 80s, they were dealing with uncertainty over trade and tariff policies, fluctuating markets, loan rates are still dealing with some of that. Flood and weather-related issues are huge, as are insects and disease and various other things. So they have very unique stressors, farmers do. And agribusinesses that work with farmers are also affected with some of these. So then we're going, we look at rural areas. So most of our farming is in rural areas, and they have 20% fewer primary care providers than urban areas, and significantly less psychiatric mental health providers, as you can see in the numbers. So, and you couple that with the fact that we still have a good percentage of rural Americans that struggle with broadband and internet connection at home. So you can see their rural communities have a suicide rate that's between 18.3 to 20.5 per 100,000 residents. So it is significant. And one of the biggest things with rural communities and farmers as a whole in terms of mental health and suicidal ideation is isolation is a big factor, and just not having the means to get the help they need sometimes. But also some of the barriers to agriculture in rural areas is a lot of people have self-imposed barriers about asking for help. So they're very self-reliant, they're very stoic, and I don't need help, and they don't want to ask for help. Now, if they're offered help, they may take it, but even then, sometimes it's tricky. So there's also a lack of trust in maintaining any kind of confidentiality, because in small rural areas, everyone knows everyone. And while that's a positive thing in many cases, sometimes with that is fear of judgment from others if they're possibly connected with some kind of mental health distress. And so there's often seen mental health issues are often seen as a weakness, even though all of us, absolutely every single one of us, if we were to be really honest with ourselves and others, have had some kind of mental health, whether it be depression, anxiety, those kinds of things. It's very common. So we've done workshops across the state for the last couple of years, and every workshop that we've conducted, I asked the question in the room, how many of you have either had problems with mental health yourself, have a family member or a friend or someone that you know that has? And I will tell you, almost every single person in every room where we've done these workshops have raised their hands. So why don't we talk about it more openly, like we do our physical health? And that's what we are trying to change, is the stigma around that. So it becomes more second nature for us to talk about our feelings and our mental health, like we might with our physical health. So anyway, getting back to challenges and barriers, time and transportation to go to a mental health professional, as we indicated previously, we don't have the same number of providers in rural areas. So if they had to go somewhere for an appointment that, say, was an hour away, which is not uncommon, you have to take time away from the farm, time away from work, rely on others, and transportation as well. So that's another barrier. Also the broadband, again, we're going to talk, that's been mentioned. And oftentimes lack of an adequate health insurance coverage. I think a lot of health insurance entities do provide some degree of behavioral health, mental health services. However, it does vary. And then I already mentioned the feelings of isolation and having somebody that you can trust to talk to about your mental health. Improvements happening. The American Farm Bureau Federation, national organization, has done a couple of studies over the last few years, so 2019 and then comparative to 2021. Their sample size, 2,000 rural adults. And so we're seeing a decrease between that 2019 to 2021 of people expressing stigma around mental health. So we are seeing a decrease in the level of stigma that they feel is there, which is good. And also an increase saying that they're more comfortable talking about solutions with family and friends. So that's good. Those are small changes, but they're in the right directions. So we're glad for that. I will say our younger generations, our younger adults, are also experiencing mental health and stress challenges. But quite honestly, the younger generation is far more open to talking about this topic than us older folks. Whoops, sorry about that. How are we in Indiana? Here's some numbers about Indiana prior to and after the pandemic. So you can see that the pandemic did increase symptoms of anxiety or depressive disorder, from 1 to 10 to 3 to 10. And it may be higher even now. And then some reports of anxiety and depression, and comparative to US rates or national rates, Indiana is just a little bit less, but we have significant issues in our adolescent population. And I think many of us are aware of some of that. And again, that's, I think, COVID related. So the percent of people needing mental health professionals in Indiana, compared to the national is again a little bit higher, and we have fewer because we are rural, we have fewer providers, so that makes sense. And then we have people expressing symptoms of anxiety and depressive disorder, needing therapy but not being able to receive it in the past 4 weeks. So that's really a problem. I will tell you that are on the webinar today, if you are working with someone, encountering someone that is having mental health issues and they can't get into a counselor or help, there are a lot of online resources that are helpful. But I will say, if somebody has any kind of suicidal ideation, that needs to be communicated to mental health professionals, and they will do their best to get them seen immediately within that same day. And I know that for a fact because I've gone through that process with one of my adult children. So don't be afraid to ask about suicidal ideation, and if they do respond affirmatively, you need to help them get some help promptly. Indiana has done a couple of things in recent years. Some may be aware of the Public Health Commission that was formed within the state and looking at public health within Indiana. And there are some recommendations and some things are moving forward in that realm. They also formed a behavioral health commission. Behavioral health, mental health are one and the same. There is a report that was issued in September of 2022. You can find it, just really do a Google search on Indiana Behavioral Health Commission and you'll find the report. But some basic high level summation of it is that we need to build a sustainable infrastructure around mental health in Indiana. And they are working on that. And they want to improve overall mental health and well-being. We know that there's a workforce issue. I've already spoken to that in terms of availability of mental health providers. There were some additional recommendations. You can look at the report for those details. And then how are we going to fund it? So Indiana is looking at this and wanting to make some improvements, which is a very positive move on behalf of the state. So recent advancements is the national rollout of the 988 hotline. It is active now. I know that they're trying to do a lot of work and get funding to support that. So that's a very easy number to remember. Again, if you ever have an issue where you're struggling or someone you know is struggling and you're not sure how to address it, please call the 988 to get advisement on that. There are also phone apps that can prevent or intervene in a crisis. So look into some of those, make sure they're well reviewed and rated. Online resources as well are available around mental health. And then a lot of times physicians can do some blood work and test what kind of medications would be best for an individual based on their chemical compositions and things like that. So it can be targeted. And then telehealth can provide access to therapy. Oftentimes, before an individual can be seen on a telehealth basis, they often need to have their first appointment in person for a variety of reasons. But once that is put into place, then you can get telehealth, and it's much more discreet than in person. It can be accessible over a cell phone. So that could be real appealing to rural and farming communities. So what can you do to optimize the mental health of yourself and friends is, again, and this is some of how we change the stigma around mental health, which is changing, but we can still continue to do more, is to be very open about discussions about life struggles and stress with your friends and family. If you are more open about your own struggles, which again, we all have, they are being more likely to open up and share with you. It's very important too in that process that you be a source of non-judgmental support. and I cannot stress that enough, is anyone that's struggling with a mental health issue, the last thing they want to do is feel judged by someone else. So it's very important that you be non-judgmental, that you actively listen, and be supportive and compassionate and empathetic. Okay. Also, model and encourage healthy habits and lifestyles. Physical health and mental health do go hand in hand. So know that. And again, talk and share your own struggles with others and how you may cope with those. It might be really helpful for others. Encourage your faith-based community and other community groups to discuss mental health. Faith-based organizations kind of struggle with this topic sometimes, but it is a place where a lot of rural and farming individuals will go for counsel. So we want to make sure that our faith-based communities address mental health and suicide from a scientific standpoint, along with promotion of their faith. So yeah. So this is my contact information. I'm very open to any questions or comments. One thing that I will tell you is the Healthy Minds, Healthy Lives program is continuing to offer organizationally hosted workshops across the state. These are free of charge and include this presentation that you've seen today, as well as some additional information from a consumer standpoint about telehealth. We also present information about the Purdue Farm Stress Program and conduct a QPR Question, Persuade, Refer, which is a suicide prevention program. So those are what's included in our organizational workshop. If you are interested in hosting one in your community, please do get a hold of me. So other than that, I am open for discussion and questions.
Thanks, Kathy. I don't see anything popping up in the Q&A function yet, but I did just send a reminder to chat that if anybody has any comment or questions to pop something in there. I guess I was taking a few notes. I come from a rural community in Kentucky, and when you've been to one rural community, you've been to one rural community. So I guess what I'm curious about is you mentioned some of the structural barriers, like just geographical distance, but how do other sort of like big issues kind of impact rural communities and access to mental and behavioral health services more broadly than just number of providers and the geographical distance that they have to travel?
Yeah, good question. I'm thinking on that a bit. I do think, as I mentioned,
I guess what I'm thinking.
huh?
Sorry, no, I guess I'll lead you a little bit differently because that's a little bit of a broad question. I guess I'm thinking specifically, I think many of our audience members and many people generally probably tend to see all rural communities as relatively homogenous, but they experience the world very differently. So
Yes.
and so I'm curious, what are some of the larger issues at stake here that are not just cultural, but maybe even socioeconomic or any other variables that might be at play here?
Right. Hard to answer, but yes, living in rural areas can be very isolating. So a lot of times I think people in rural areas feel alone with their mental health struggles. And there's also, I think a lot of times rural areas can be somewhat more diverse than people might think. But actually there's also some, how do I want to say this? My experience is that the judgment is a little more prevalent in rural areas, not as open to diversity in rural areas. And so individuals with mental health, or maybe some not so homogenous lifestyles are really kind of feel that isolation maybe a little more. So yeah, I think sometimes we need to be to look at, and every community is so different. I mean, I lived in a small rural county and worked in with another county in very small rural county, and they were totally different. The two counties were different in terms of the demographics of and politically, socioeconomically. Socioeconomics is interesting because too, I think oftentimes with lower incomes or lower levels of education and understanding of resources, literacy, and those kinds of things, which, seeking out self-help or being open to talking with somebody about it could be really limited in that demographic for the reasons stated.
Yeah, there is a Q&A popped up here. I'll go ahead and read it out for the group. I'm glad you touched on that, because sometimes our most vulnerable populations are sort of doubly vulnerable given different social contexts.
Well, and
so somebody has,
go
sorry,
ahead.
somebody has asked that you've touched on the isolation issue. Do you know of any programs that are working on social connectivity to address mental health? Maybe not necessarily just access to clinical care.
Yeah, that's a great question. I don't know of any offhand. I would suggest looking around the local community about maybe community groups or what mental health programs are there, and see if they have a community-based organization or group that meets just to talk. Again, it might be something in a faith-based or a community-based organization might be interested in starting up just to give people a place to come. But I don't know of any programs per se doing that. Great question, though.
Well, I think to speak to that, I used to work on the Indiana Rural Opioid Consortium, and I think to speak to that attendee's question, that kind of connectivity is hard to find funding mechanisms for, I think, because it's kind of hard to demonstrate sort of material outcomes from that kind of programming. But nevertheless, it is a huge component of this. And just to ask you another follow-up from my perspective, and I know you touched on it briefly in your presentation, but how does substance use kind of like factor into all this, and what makes rural populations, especially post 2017, when the United States hit kind of a historic high in terms of overdose death rate and hospitalization rate, how have the past 6 years kind of molded and changed, especially during and post-pandemic world, in the substance use space, and how that interacts with mental health?
Well, substance use and mental health are directly correlated and connected. Generally, I would say that individuals with some substance use disorder usually generally have an underlying mental health condition, and they've learned to not necessarily deal with the mental health situation from a therapeutic standpoint, but rather through substances. So they're self-medicating oftentimes. And oftentimes, it could be connected. Mental health, substance use issues could also be based on a post-traumatic stress situation that the individual may have had in their childhood, adverse childhood. What's the term? Adverse childhood experiences. There it is. But those, and I think those are really, those can happen to any demographic, but I think oftentimes those do occur more frequently in your low socioeconomic populations. So it gets really complicated, but mental health and substance use are interrelated. So if we can get people off the substance use and then start to look at their underlying mental health conditions, that's, I think, where we can really make the best progress. But I hope that answers the question.
Yeah, we've got another one here in chat from Andy. Historically, some insurance payers require prior authorization or documentation for payment on mental health services, and we face this issues with specific payers here in California. Is this an issue in Indiana?
I can't answer that because I don't work in that realm. It would be dependent on the health insurance plans individually in terms of what they require. But yeah, I can't really answer that other than in that manner. Sorry.
I can speak a little bit to this just because we deal with a lot of questions on reimbursement and billing for telehealth services.
Sure.
And I know that Indiana's Family and Social Services Administration, FSSA, which is the sort of umbrella organization of Indiana Medicaid, does have some rules about prior authorization, at least to initiate services and maintain mental and behavioral health coverage. So, it's certainly way less restrictive in the sort of post public health emergency world than it ever used to be. I think Medicare also has some rules around this, and I think private payers, it just kind of depends on who the entity is at that point. But some of the managed care entities here in Indiana might have a little bit more complexity surrounding it than I'm maybe giving it credit for off the top of my head. But Andy, if you want, I can have Danielle put my email in the chat function, and you can email us directly to follow up about that.
I do know people that have gotten mental health services that are on Medicaid and it's been covered. I don't know if they had to go through any kind of prior authorization or not, but good question though, Andy. Good luck with your clinic.
Kathy, I had one more question because I know that we get this a lot when we're just kind of presenting in other spaces too. What are some of the unique circumstances in Indiana and maybe even the Midwest broadly, depending on how you define that region of the United States? Since we have people here from all over the country, there may be people here in frontier regions who may be close to even more geographically isolated communities in some of the other Western states. Even tribal lands, those sorts of things. What are some of the unique challenges to recruiting and maintaining a workforce around mental and behavioral health? Because you've mentioned that being one of the big issues. So can you speak at all to some of the experiences that we've had here in Indiana that kind of make it hard for us to even, get people access to the care they need?
Well, they've got a shortage of providers in the first place. And I think that's not unique to Indiana. I think that's a national situation where we have a shortage of mental health providers. And then we've got a big demand right now. Some would say we're having a mental health crisis. I've heard that term. So in terms of, getting these workforce, I don't know what the answers are. I think that there may be some recommendations on that, and I haven't, to be quite honest, looked at the Indiana Behavioral Health Commission report about workforce development, but I know they've likely looked at it in detail. But it's just as with primary care providers, it's a little more difficult to recruit to a rural community versus an urban. I think there's compensation differences, I'm guessing, but I'm pretty sure of that. There's just lifestyle it's a different kind of lifestyle living in a rural community versus an urban. And whether providers are really interested in that from a personal standpoint. Now, the need is there, the demand is there, and there are organizations. I know the area health education centers in Indiana are working to try to place health professionals, including behavioral health professionals, in more rural areas. But it is a challenge for some of those reasons. But I would encourage, just looking in more detail at that report to get a little more detail. But those are my thoughts.
Yeah, I know that there are also different licensing and credentialing requirements from state to state. So if you go to,
Yes.
medical school in Wisconsin and then potentially move to Indiana, there's all kinds of, different requirements there. I'm sure that's an obstacle as well. I would be remiss if I didn't follow up a little bit and ask you, how can telehealth impact some of these provider shortages? And we know, like, of course, it's not this kind of broad, like, reaching panacea that's going to solve everybody's problems, right? But I think this is perhaps the one, like, care delivery mechanism and service line that is just, I mean, it just fits hand in hand with telehealth implementation, right? I mean, and we've seen a lot of gains in this space, at least from our anecdotal perspective, over the last 3 years in particular. So do you want to comment on that?
Well, I think I mentioned it a little bit in the presentation. Is a lot of times with behavioral health, it's my understanding that you need to do an in-person assessment initially. But I know many people that are getting behavioral health, mental health services through telehealth, and successfully so. And in many instances, telehealth may be more beneficial than an in-person, especially for someone that may have some social phobias, some anxiety issues. Um, Going out in public can be a challenge, and telehealth can really help with that. They can do it in the privacy of their own home. It's my understanding that reimbursement rates for telehealth have improved significantly. You can probably speak to that, Luke, a little better than I can. Um, but yes, telehealth, behavioral health services, I definitely have increased, and it's a very good thing for everyone, and would encourage people to seek that out.
Yeah, I mean, you mentioned reimbursement for sure, and some of those, like, prior examination requirements have also, been dropped almost unilaterally across our region. So
Okay, good to know.
even initiating services via telehealth is easier than ever before. I mean, anecdotally, I mean, I've heard of farmers literally, during harvest time, having calls with their providers, like, on their device, like, while they're in the combine, right? And
Absolutely.
yeah,
Yes,
so
yes, yeah,
that's a tremendous an absolutely tremendous service that's available if we are able to provide the infrastructure and requisite education to make sure that providers also buy in.
right, right. Nothing's ever straightforward, but yeah. But I appreciate the opportunity to talk about this and this topic. It's something that I'm passionate, is near and dear to my heart about. So glad to help in any way we can.
I will keep the Q&A function open here for just another couple minutes to see if anybody has any follow-up questions. We really appreciate you being here, Kathy. I think everybody who's on here has at least some vested interest, not only in rural communities, but also in agriculture broadly. As you mentioned it right at the top of your presentation, it is sort of foundational to, the not only economic fabric of the United States, but it's also interwoven into our kind of cultural and social narrative as well. I mean, the
Especially in the
bread,
Midwest.
right? Yeah, I mean,
Yeah,
all of those terms, right? The bread basket, the heartland, right? All of these terms
exactly.
are, they become popular and part of the nomenclature for a reason. Um, uh, yeah, Andy, you are correct. That's why I wasn't sure exactly when those would be lifted. I anticipate that some of those will actually remain permanent. That rural health that communities for rural health services, especially mental and behavioral health, will lift that face-to-face requirement in some capacity, or keep extending that until we can kind of gather the requisite data and publish. And hopefully, the data lag is not one of the operative issues here.
Well, we saw too. with our rural hospitals, the emergency room, definitely you want to take someone in crisis state to the emergency room if there aren't other resources. But I will tell you that there are rural hospitals that are closing emergency services. So that presents us with yet another challenge. It just seems more and more that we see more focus on urban than rural, because it makes, I mean, that's where the people are, but that doesn't mean that we need to focus, I believe personally, on where the issues are, and improve those versus just the masses. But that's my personal opinion. So
this just kind of popped into my mind, Kathy, because it's kind of front and center here in terms of the popular discourse here in Indiana. Some rural communities that have been historically sort of steeped in farming are experiencing a lot of economic challenges in the form of job closures, or like, I guess, like contractions in terms of like plant closures and things like that. I don't know if anybody's been following some of the news surrounding Tyson. You know, one of the big facilities here located in Corydon, Indiana, which is in the southern part of the state. As you drive from Indianapolis to Louisville, is closing, which is going to impact hundreds of jobs in that community. So as we see more and more economic challenges, how do you kind of like energize the populations that you serve to not just care, but like really become active and trying to advocate for their own mental health?
yeah, again, as I mentioned, work with your faith-based organizations, your community groups, start one of your own. Don't be afraid to advocate for this topic in your own community. Your community foundations, your local elected leaders. The Tyson closure, we've got 300 and some people likely losing their job, but that's also going to affect that community. It's not just people losing jobs, which is not insignificant by any way, shape, or form, but it also has a trickle effect throughout the community. We've been down and at meetings about that, and there's a lot of anger, there's a lot of stress, there's a lot of concern about their future financially, and understandably. And so, but yes, I think we need to have more of a sense of community around mental health. We're all here together. We're all sharing the same planet, and we share and care, be more caring of each other and try to help each other. And there's in the mental health realm, I can't speak to that loud enough. So don't be afraid to be an advocate for this topic. And if you can't find a community group, start one. I'd be glad to brainstorm some things with anybody if that's something that you want to look at. But don't be afraid to get involved and support your community, because mental health affects us all. It really does. And so.
Well, I think that that's about as good a note to end on. I don't see any other further Q&As. Just a reminder, one of my other colleagues, Jessica Devine, has posted in the chat to please complete your evaluation of today's programming. Kathy, thank you so much. And then again, how can people get a hold of you if they maybe don't live in Indiana per se, but want to just chat about these issues in the rural parts of their state and want to get involved?
Yeah, I'm putting my my phone number and email address in the chat. Feel free to contact me anytime.
And I will send out that information when we send out our slides later this week, so you can follow up with Kathy there that way as well. Yeah, and it's in the slides as well. So we'll also include the information in our next webinar in that email. So look forward to that. Thank you for the opportunity, and I hope it's been helpful.
We appreciate you, Kathy.
Thanks for joining us today.
You're welcome. Have a great day.
Okay, thanks so much, everybody. We will end there for today, but we appreciate all of you joining us, and we'll see you again next month.